Despite recognizing that the goal of gender affirming care is to, quote, partner with trans and gender diverse people to holistically address their social, mental, and medical health needs and well being while respectfully affirming their gender identity, the World Professional Association of Transgender Health, or WPATH's, Standards of Care version 8 fails to expand upon vague calls for social services and accessibility. My name is Morgan Willison, and today I will be presenting the findings from my senior thesis, Beyond Surgeries and Hormones, Community-Specific Gender-Affirming Care, Research, and Innovation. While a wealth of research has documented the negative effects of denied or delayed care, the positive effects of accessing care, and the barriers to care for trans and gender diverse population, including insurance and financial obstacles, stigma, lack of clinician training, and transphobia in healthcare, few studies are dedicated to examining the tangible ways gender-affirming care clinics promote accessibility through non-medical services. What limited scholarship does exist on this topic analyzes clinics within the same cultural context. Given the life-saving nature of this care, it is essential to not only understand the barriers, but how to overcome them. With this project, I extend previous research, offering a cross-cultural analysis of the crucial community-specific gender-affirming practices beyond hormones and surgery, including community-based research, patient and family education, and social and financial support services that enable greater accessibility of care. I conducted interviews with 10 clinicians and staff members, recorded participant observations, and assessed patient-facing materials from 3 clinics in urban environments in the US and Thailand. Tangerine Community Health Clinic in Bangkok, Thailand, Fenway Health in Boston, Massachusetts, and Howard Brown Health in Chicago, Illinois. Rather than secondary additions to clinical care, I argue that these services are an integral part of offering gender-affirming care, deserving of recognition within SOC 8. The practices I observed at these clinics can be organized into 3 categories: research, education, and innovation. For the purposes of time, I will be focusing on the research and innovation categories. Each clinic endorsed research aligned with the priorities of their local trans and gender diverse community as a key method to maintain patient health and satisfaction, as well as advance the field through unique innovations. While the SOC 8 advocates for clinics to, quote, partner with trans and gender diverse people, unquote, on their healthcare, the document offers few concrete examples of how to involve the community in this way. WPATH suggests consultations and partnerships with trans and gender diverse communities to ensure the language used in clinic settings is relevant and inclusive, but they fail to expand this recommendation to community-based research and engaging community feedback beyond language. All 3 clinics have ongoing efforts to reach out to and hear back from their local trans and gender diverse community, including community consultations at Tangerine, developing a community advisory and accountability board at Fenway, and using focus groups at Howard Brown to curate services to patients' needs. These actions are targeted at more than updating language usage, as SOC 8 suggests, instead delving into patients' experiences and expectations. By establishing and tailoring their services alongside the local trans community, these clinics ensure that the care that they are providing is relevant and meets their patients' priorities. In response to feedback and community consultations, each clinic engages in social, medical, and implementation research at their in-house research institutes to inform and improve their services, particularly focusing this research on community priorities. At Tangerine, this included conducting new studies to answer patients' frequently asked questions. Describing their past projects, one participant explained, when we first opened the clinic, there were so many questions from the community about, if I'm on gender affirming hormones, would it be okay if I take PrEP? Would it affect the outcome of my transition? Because that's one of the community's priorities. And that's one of the research questions that we have already answered so that we have the evidence-based information to offer to the clients. In addition to and informed by their research, all 3 clinics utilized innovative and holistic approaches to enable greater accessibility of their services for their clients, including social services, expanded models of care, and team organization. While none of these clinics offer identical services, representatives from each emphasized their effort to become a one-stop clinic for trans patients, adding more services to ensure access to affirming care regardless of the patient's concern. This cuts down on the time spent by patients searching for affirming providers, which may lead to healthcare avoidance and further health disparities. The inclusion of these services also recognizes an expanded definition of gender-affirming care beyond access to hormones and surgery to include aspects of primary care, interactions with staff, mental health, and more. Each clinic also had an in-house pharmacy, and Tangerine and Fenway have in-house labs, allowing for same-day testing, treatment, and access to prescriptions. In addition to the traditional medical practices offered, the clinics also spent resources on social services, such as social affirmation assistance, insurance and surgical navigation, and more. Fenway Health uses grant funding to provide non-medical gender-affirming gear, such as binders, packers, and breast forms, for free for their patients. And both Fenway and Howard Brown offer dedicated insurance navigators to assist with enrollment. Howard Brown also has a surgical navigation team dedicated to assisting trans and gender diverse patients with, quote, planning and coordinating from pre-surgery requirements to post-surgery recovery. Tangerine offers a similar program, connecting their patients with experienced specialists and transgender personnel to ensure a smooth transition. One participant from Fenway Health illustrated the importance of these services. They said, education and navigation workers are considered essential to health center operations. If we are not directing patients how to navigate our system, some will choose not to. Providing these services that enable greater accessibility is an essential aspect to combating isolation that a lot of trans and gender diverse folks report, or difficulty navigating systems, or lesser access to different kinds of health systems. Having direct supportive services are essential for our providers to be able to focus on the care that they are experts in. We're able to fill in gaps in a way that other pieces of the system might not be able to. From surgery and insurance navigation to community-based research initiatives, none of these crucial gender-affirming practices are represented in WPATH's SOC, the leading international guidelines for gender-affirming care. I argue for more tangible guidance with specific examples be included for clinics seeking to offer care beyond hormones and surgery. More research is needed on the non-medical gender-affirming practices with particular focus on clinics in non-Western countries. Thank you very much for watching this virtual presentation. If you have any questions or would like to follow up, please feel free to reach out to the email provided on the poster.